Hi, this is Landy with Peak Possibilities, and today I want to do common questions about pelvic therapy. And so pelvic therapy, maybe you just heard about it or you're curious about what it is. It's kind of like physical therapy or occupational therapy, but it is for your pelvic region. And so pelvic therapists help people with incontinence issues, bladder leakage, bowel leakage, prolapse, so that heaviness in the vagina feeling, pelvic pain, bedwetting issues, constipation, hemorrhoids, anal fissures. Prenatally, I specialize in prenatal and postpartum pelvic therapy. So prenatally, I help women make sure that their pelvic floors and their pelvis have good mobility and their pelvic floor can open, and we're not going to have anything that's going to impede a smooth birth. And then postpartum, making sure that everything is healing well, so your bladder shifts back to midline, and your open birthing pelvis, if it is stuck in that open birthing position, has healed and closed back down, and I gently help with that. And so there's a lot of different reasons people come to see a pelvic therapist. So what happens on a first pelvic visit? And so same like any other office, you call to schedule. I'm going to send you paperwork, and that's going to give you a history of what's going on. That first visit, we're going to sit down and chat for a minute, and we're going to say, what are your goals? And what are your biggest concerns? And from there, we'll develop what we're going to do. So as adults, what's going to happen is I'm going to start externally, and I'm going to look for any imbalances. So do we have one hip that's kind of, up because we're holding babies? Do we have an open birthing pelvis? Do we have rotation in the pelvis? Like, what's going on externally that could impact the pelvic floor? Then I'm going to have you lay on the table, and so my room is set up kind of like a massage room, and so I just have a table just like a massage therapist would, and this is all fully clothed. And so you're gonna lay on the table. I'm gonna do some releases. I'm gonna check for your diastasis recti. I do visceral manipulation. And so I'm looking at organs. So how's your liver? How's your stomach? How are your intestines? How's your colon? Like all of that could be impacting pelvic floor issues. So we're looking at externally, fully clothed, what's going on. And I'm gonna talk you through everything that I'm gonna do. And I'm gonna ask your permission if it's okay if I do that every step of the way. Then if internal work, because that's the next big question, do I have to do internal work? No, you don't. It is your body, it is your choice. And if you're not comfortable with internal work, there are things that we can do externally to get similar releases. And so if internal work is something that I think you would benefit from, I will talk to you about it and say, I think you'd benefit from some internal work. Are you open to that? If you are, then I'm gonna walk you through. But it's not like the gynecologist. There's no stirrups. It's just bending your legs. You're fully covered with a sheet, and then I'm going to talk you through each step of the way that I'm going to do things. So then we're going to check your pelvic floor, your Kegel strength. Is your bladder in midline? Is your urethra squished? Because if you've had a baby, sometimes those urethras get squished. Do you have a strong Kegel in every quadrant of your vagina? And that's huge, and it's so interesting once I'm calling attention to it. And I'm saying, okay, do a Kegel strength on the bottom right, Kegel strength on the top right, and women will go, ooh, there's a difference. That top's a little weaker, and they're experiencing leakage. Yes, and it's not necessarily due to weakness. It could be due to a tight muscle. Releasing that tight muscle, we check it again, and it's like, ooh, I could feel the difference. And that's where we get the nice symmetry. Everything is talked through, and it's your permission each step of the way. So it is not a big, scary thing. You can come in and decide, coming in fully thinking, I want to do internal work, and go, nope. Or switch halfway through the session and say, I think I do want to try that internal work, and that's okay. And you can, anytime you say no, we're done, we're done. It's your body, and I'm following you. So if you have any questions, I would love to chat. This is Landy Peak with Peak Possibilities, and I look forward to talking to you soon.